What is an induced coma in intensive care? Why is my loved one in an induced coma, and what does it mean for their recovery? My name is Patrik Hutzel from intensivecarehotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision-making fast, even if you're not a doctor or a nurse in intensive care. If you have a loved one in intensive care right now and they've been put into an induced coma, you're probably worried, confused, and you want clear and simple answers. Let me break this down for you in a way you can understand. What is an induced coma in intensive care? An induced coma is not the same as a natural coma. It's a medically controlled state created by giving strong sedative drugs in order to, quote unquote, shut down the brain and body for a period of time. Doctors and nurses in ICU use medications such as propofol, midazolam/Versed, also fentanyl, morphine, as well as Precedex or dexmedetomidine, or sometimes even barbiturates to keep patients asleep, unconscious, and pain-free. This is done deliberately, meaning your loved one is not in a coma by accident, but rather put into a state for a specific and ideally time-limited reason. So why would your loved one be put into an induced coma? There are several reasons why an induced coma is needed in intensive care, including number one, mechanical ventilation, breathing tube, and ventilator. If your loved one needs a breathing tube, they almost always need sedation so they can tolerate the ventilator. Number two, brain protection. After events like head injuries, seizures, or cardiac arrest, an induced coma may protect the brain and reduce swelling or oxygen demands. Number three, pain control after surgery or trauma. If your loved one has had major surgery or injury, sedation and induced coma can help manage pain and allow the body to rest. And number four, to stabilize critical illness in situations like sepsis, multiple organ failure, or severe respiratory failure. Keeping a patient in an induced coma allows ICU teams to control the situation and give treatments without the patient fighting against life-saving machines. So, how long will your loved one stay in an induced coma? This depends on the underlying illness. Some patients may only need to stay in an induced coma for a few days, while others may need a few weeks. The important thing is this: the longer someone stays in an induced coma, the higher the risks of complications such as infections, muscle weakness, deconditioning, and difficulties coming off the ventilator. This is why many families feel anxious about how long this will go on. Will my loved one wake up from an induced coma? Here's the truth: most hospitals and ICUs don't tell families clearly. Waking up from an induced coma is not like flicking a switch. It is more like switching on a light with a dimmer. Once sedation is reduced or stopped, it can take hours, days, or even weeks for someone to regain consciousness. The speed of waking up depends on the reason they were placed in the coma in the first place, the length of time they were in the coma, their age, and overall health. Complications such as infections, strokes, or seizures. Also, the sedatives and opiates that were used and in what quantities. For example, if propofol was used, propofol is a short-term acting sedative, so patients should wake up pretty quickly once propofol has been stopped. If midazolam has been used, on the other hand, it is long-term acting. So once you wean the midazolam, it takes a lot longer for patients to wake up, generally speaking. And also, if you're using a lot of morphine and fentanyl, it also takes a lot longer for patients to wake up. And also, if patients are paralyzed during an induced coma, i.e. they are chemically restrained with paralyzing agents such as cisatracurium, rocuronium, vecuronium, then it might also take even longer to wake up. So, why do families need to ask the right questions? If your loved one is in an induced coma, you need to ask the ICU team, why exactly are they in an induced coma? How long do you expect them to stay in this state? What's the plan for waking them up and weaning them off the ventilator? What are the risks and what's being done to minimize them? Unfortunately, many families don't know what to ask, and that leaves the ICU team with all the control. That's where we come in at intensivecarehotline.com. We help families like yours to ask the right questions, to understand what's really happening, and to make sure your loved one gets the best care and treatment. So if your critically ill loved one is in an induced coma, do not feel powerless and do not feel left in the dark. You need to understand the situation in detail, because the more you know, the better you can advocate for the best care and outcomes. And you can also book a call with me directly by clicking on the book an appointment tab on the top of the website. I offer one-on-one consulting and advocacy for families in intensive care, so that you can make informed decisions, have peace of mind, real power and real control, making sure your loved one gets best care and treatment always and gets the best chance for recovery. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can very, very, very confidently say that we have saved many lives with our consulting and advocacy because of our insights, and you can verify that on our testimonial section at intensivecarehotline.com, and you can verify it on our intensivecarehotline.com podcast section, where we have done client interviews. And because our advice is absolutely life-changing, right? The biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And that's why we help you to improve your life instantly, making sure you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And that's why you can join a growing number of members and clients that we have helped over the years, saving their loved ones' lives. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to families directly, I also talk to doctors and nurses directly, asking all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care. So if in case you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. And all of that will help you to improve your life instantly, make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my video, and if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification from the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrik Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.